Welcome to the Health and Wealth Power Hour, the podcast that provides you with the knowledge and insights you need to achieve physical, mental, and financial well-being. I'm your host, Harlon Pickett, a business consultant who's passionate about helping people achieve a more balanced and healthier life. Each week, we'll deep dive into topics related to health and wealth, including retirement income planning, innovative healthcare solutions, alternative funded health plans, and specific actions individuals and business owners can take to gain control of their finances, have access to affordable quality health care, and achieve peace of mind. We'll also be joined by innovative experts who will share their knowledge and insights on prevalent topics. So, whether you're looking to grow your wealth or improve your health, you've come to the right place. Get ready to be informed, inspired, and empowered. Let's get started. All right, and welcome to another episode of the Health and Wealth Power Hour. While we are so glad for you to be here today, we're almost as glad as the lawyers are about the Consolidated Appropriation Act. I'll tell you what, there is a lot going on out there. If you haven't seen it, that means you hadn't been looking. I'll tell you, even big companies going after each other right now. We have Heinz Kraft going after Aetna. We have big unions going after some of the blues. Consolidated Appropriations Act is pulling the blanket back, is really shining some light on some unsavory behavior. So I'm sure today with my guest, we'll hit on that as well as a number of other things. Matt Ohrt is joining us today. He recently released an incredible book called Save Your Company, Don't Feed the Beast, the Employer Healthcare Success Formula. And that's exactly what it is. It shows employers how to stop feeding the beast, which many of these employers are just now finding out about because of the CAA. It goes directly to what Matt is writing about in his book to tell you how to stop this. In some cases, you'll never know what's happening. If you're not a big enough company to go after some of these, I promise you, their lawyers will not let you get past go, as it were. But the reason Matt has such a great introspect on this is because he's not an insurance broker. He's not an insurance advisor, but he still knows how to build plans because he actually did it from an HR position. After many years as an HR executive, he started realizing the problems were happening and he started taking action himself, not looking for someone else to do it, but started taking action himself. And he did it in a state where there wasn't a lot of things to work with there. In the state of Wisconsin, which at the time he started down this pathway, he did not have a lot of relationships and he did not have a lot of ways to turn to build these things. But he made it work and he's still working diligently today towards this. We are super, super honored to have Matt Ohrt, who is not just a mover and shaker in the insurance industry, but is a proud foster parent and a real champion of that organization and setup as well. So Matt, welcome aboard, buddy.
Yeah, it's great to be here with you today. I look forward to our discussion. I'm sure it's going to be a good one.
Yes, sir. Absolutely. I have one question for you to start out, and I bet you it's going to bring up a whole bunch of other things. Why did you write this book to begin with?
Yeah, great question. I can tell you, well, even this whole journey of healthcare for me wasn't planned. I've been, as you mentioned, the employer background, so just short of 25 years working for employers. And honestly, I always found healthcare or the health plan boring. And so so I'm wired in a way that I like to improve things and I like to help people and communities and make something better and so forth. And I think it was because I didn't see any opportunity there. A lot of times working for big corporations in the first half of my career, Fortune 100, they're very formal. They give you the script for the enrollment and you get up and you lead the enrollment. And so that wasn't very fun for me. And sometimes even when I kind of was disagreeing or frustrated with some of the details of the presentations, but something changed for me. I started seeing the light in about 2013-ish, and I had experimented with a nurse practitioner, but really didn't know much. And then in 16, took the VP of HR role with Meryl Steele. And then as we took the plane off and then we started building it. Things weren't as well known back then. And then that led to a success story, and it led to awards, and it led to a whole bunch of people calling me, the central Wisconsin employers, and saying, Matt, how'd you do it? And so that was kind of the spark. But I can tell you the healthcare journey, even now transitioning my career to co-found Self-Fund Health, which is a high-performing self-funded health plan, none of that was in my sights at all, and I never would have imagined. So the book was really, I think, ultimately to fill a need. And, it was a need of how'd you do that? And then it was hard to explain. So it's like, wow, there's like a long conversation here, as you well know. And it was really to fill a need of education and practice that I think is missing today. Even if you look on Amazon, right? I mean, if you look at employer success stories or high-performing self-funded plans, it's pretty much missing on Amazon, and I'm not sure why, but it is. So maybe we can all change that.
Yeah, that's interesting you say that, because both of us attend a few different conferences a year. Mm-hmm. And at those conferences, there's always those success stories, right? We always hear, whether it's a school district or a company like Merrill Steel, or even a municipality, someone that has had a success story. But you're right, there's not really any books about it. There may be some industry stories about it. Maybe there's a write-up about it somewhere in an industry magazine, but mm-hmm. there's not really any books about it. And there's certainly, whenever you read the success story, it doesn't really tell you all the details of how they got there. It just tells you, oh, they saved $23 million, or maybe they only saved $34,000. Whatever it was, they talk about that side of it. And maybe they say they implemented, and if you don't know, you don't know, right? They implemented DPC. Well, okay, but how? What? Why? When you say implemented DPC, okay, I'll look that up and see what that is. All right. But how? How did that make any difference? So I don't understand why that worked, or what is really happened in that process. And so I agree with you 100%, because as we have talked a number of times, and I've heard your story a number of times, but until I read your book, right, I didn't really understand how you did it, the actual process you went through to do it. Mm-hmm. And all the way from the beginning, whenever I've heard the story that you had an accident with a tractor. Well, after reading your book, now I really understand about the accident you had with your tractor. Holy moly. Yeah. What a deal right there. I mean, that was eye-opening as well. Yeah. All the way, it's one of those situations where I love the way you started the book, because it captured you. It really captured you and said, hey, I was just a regular guy that all of a sudden had need for a system and thought you'd been in it for years. I mean, you were an HR person. You knew what to expect until you didn't know what to expect.
Right. It's kind of one thing to hear it and you try to empathize and, from others, and so-and-so's got this medical condition, but it's another thing to live it. And so I think that was a bit of an eye-opener for me. I knew it was there, and I was learning those things, but when I lived it, that was a big spark for me to take significant action, which is what we did. Yeah, everywhere from being rolled into the ER with my daughter, and then not even getting attention. I couldn't get the clerk's attention. And here I could have been bleeding internally. At least she could have said, right, what's your condition? Or, maybe I look better than I was, but 5 broken ribs and a whole long list of injuries. And then probably the whole experience would just felt very profit focused. I mean, it was good people trying to do the right thing. So I always want to give the caregivers credit. But when you're put into a broken system, it gets pretty difficult. From the physical therapist, even the next day that I was released, saying that I'm required to do this, Matt. He's a very nice man. I'm required to do this, but we talked 3 or 4 minutes, and then I get a 369. And I told him I don't want PT. I have PT through work, and I get a 3. And the part of the bill was I had to request even itemized, of course, afterward. But 300 and I think it was $69. It's like, wow. I didn't get any PT. So yeah,
Well,
so
you talked to him.
that was I answered his questions, and
Yeah.
but that was a great motivator for me because now I could directly relate. And then every healthcare experience I've had thereafter, even with foster children, and even my dad passing away a few months ago, I start to naturally evaluate. I'm just observing nurses and caregivers and doctors and receptionists, and in my mind, it's like, this is really from the top of that hospital, but are they really just seeing dollar signs when patients walk in, or are they really seeing people? And it's interesting, and it seems to take kind of an extreme, it's like this one, my dad passing away in a rural Iowa hospital, they saw people, and they even had a price estimator that were even like SCO almost like prices. It was amazing. And then I see other ones where they're air flighting a child, and the receiving hospital is saying, why'd you do that? And and they said, well, because there were no ambulances available at 4 a.m. on a Monday morning to drive 30 minutes. And it's just a little bit hard to believe. So
Yeah.
but we start to kind of evaluate, are they really caring for me, or is this all about some money machine that's been created?
No, I agree with you 100%. We see such crazy things like that. We talked to a client out of Dallas that her child needed to be hospitalized in Boston because she needed a heart surgery that was only performed there. The insurance agreed to pay the transport to get her to get her there. Then they denied to pay the transport to get her home. They said, well, she's received her medical care. She received it. She's good. Well, no, she actually had to have medical transport back home because she's an infant. She had to have that level of care. But the insurance company couldn't see past the fact that the care had already been given. She's had her surgery. She's good to go.
It's a one-way ticket, man.
Yeah. She's 3 months old. She's not good to go.
Right. Well, it was kind of, and I put some of these examples, and this wasn't actually a real life example. Have you ever seen that? It's like a meme, but it shows, there's actually an article on this. I have the article, but it was a little baby. They made a onesie, a sarcastic onesie. It said free hug or hugs, $39.35. Did you ever see that one?
I have.
And that's where, so a woman had given birth to a baby, and they had a name for it. It wasn't hug.
It was skin to skin contact, right?
Right. But they actually had the nerve to charge for that and itemize it on the bill. And I had posted that once on LinkedIn, and it's like, well, you were there anyway, right? I don't know if that's really care. And so if that's how we're going to start to view things, but I posted that on LinkedIn once, and a guy said, I don't see anything wrong with that. And I'm like, boy, oh boy, is this what we've become? So
yeah. No, yeah. I remember that. I remember that story, and I think that's what it was, right? Skin to skin contact or something is what
right.
they call
it. That's what they labeled it. Yeah, it wasn't a hug, but
yeah. Because if I'm not mistaken, we had to figure it out, right? What does that mean? What does that really mean? Oh, it means a hug. Wait, what?
It means holding a newborn baby. Yeah.
Oh my gosh. I didn't check my bill for either of my kids back in the day, so maybe I should have looked a little bit closer, but I don't know. Back then, we probably didn't have quite the issue we have these days. I don't know. Maybe we did, but I don't think 20 years ago it was quite as bad as it is today.
Yeah, and that's what the graphs and even experiences. Yeah, I mean, my oldest is now 27. I've got a 1-year-old grandson. But my first child, I had started a construction business at the age of 19. I think I was 20 or 21 when we had her. I remember going in and writing a check for, I think it was like $4,500 for the full birth process for her. And so, I think this really has degraded, and the last is what in the book, and I think is my experience still, 20 to 25 years. So before that, I don't think it was that way. I can't speak for every area, right? But generally speaking, this has been in the last couple decades.
Yeah, well, I think that at some point the charge master came around, right? So when that charge master came around, it gave this fictional point that everything kind of starts from. And even in your book, you talk about another, not a really fictional point, but the price of Medicare, what Medicare will pay for something, which is used a lot, of course, with reference-based pricing, which I'll be honest, whenever I read your book, I was surprised that you were not a fan of reference-based pricing, but your reasons for not being were solid. And I think it's kind of interesting that what you are a fan of is your reference point pricing. In other words, but that's direct contracting, if I'm not mistaken, right? That's a direct contract that you really have. It's not a reference base now, right? But now we know I have a contract with you for these services, and this is what we're going to pay.
Yeah, and I've kind of labeled that as well, RBC, or reference-based contracting, where there's an agreed upon price. So I do have a little bit of an issue, I don't, in the, talking about trustworthy relationships. So if they broke trust, they clearly have, and then to send them back another number, it feels risky to me. But what I will add, most of the reason I'm against that is because it doesn't work in Wisconsin. They will shoot it down as fast as you can throw the clay pigeon up. But I do think in other states it has been shown to work. And so if I always say that if I had cases where it could work, and say patients in another state, that I would have open conversations with those members and say, here's how this game works, and are you open to it? And so it's not that I'm fully against it, but I've also seen some train wrecks in Wisconsin where the company saved a lot of money, but then there's like 100 balance bills and the wheels fell off. And so that's some of it as well. So,
right. And I know you even mentioned in your book about if a company within a couple of years of going self-funded decides to go back to fully insured, it wasn't because self-funding don't work. It's because the actions that they took were not really conducive to make it work. Right. And so that gets me to a question of what your experience has been, because I personally, and I could be completely wrong here, I think whenever it doesn't work, a lot of times it's because the employees didn't embrace it, because there was so much noise that people refused to go through with whatever grandiose plans that you had, or in some cases, smaller steps, and they just refused. They just pushed back on it so much, the whole damn thing fell apart. So how have you seen noise, and what are some of the steps that anyone can go through to prevent that, to keep these negative things from happening?
Right. Yeah. So chapter 6, it's a step in the formula, and chapter 6 is dedicated to that change management. Lead everyone from here to there, as I call it. And so I took a few notes here. So I've got a couple neat points in your questions, but the change management part is probably the biggest reason that a big transformation of any kind will fail, whether you've got a new product to market, or whether you're changing your culture, or implementing lean manufacturing, or you're changing the way you do your health plan, leading the people through that. And I found, some nuggets along the way. I studied this in school, so it's always been a passion of mine. But before healthcare, I was leading culture change. So, but the change management part is still the same. One of the biggest things that people forget on that topic, Harlan, I've made this mistake, is, right, you and I, let's say we have discussions once a week for a couple months, and we're talking about all the reasons why something's broken and why we need to change. And you and I kind of agree we need to change. And then we start talking about solutions, and then we have a good solution. Well, then we get in front of, say, the workforce of a few hundred people, and we forget about all those discussions we've had of why we detached from the bad, from the here, why we're willing to leave the here. And we all we're talking about is how great there is. Well, no, everyone else hasn't detached from here yet. I found that to be one of the biggest mistakes, or oversights, if you will. You don't want to be negative, but you've got to get them to say, we can't stay here. And then when they're willing to say that, then you can start talking about solutions. So that's one of the nuggets in the book, and one of many. It's a pretty in-depth chapter, but about change management. On your note about self-funding and companies that try it for a year or two and then bounce back, one of the biggest things I've seen there is that we seem to confuse sometimes, and I took a while to formulate this in my thoughts of how I label this, but I've labeled a high performing strategy into three parts. Or the financial part, are you going to fully insure, which isn't really a sustainable option anymore? Are you going to self-fund? Are you going to level fund? How are you going to pay your claims? How much risk are you going to take on? And then make sure you see all the dollars. There's the financial part. So if a company self-funds and bounces back after a couple of years, it wasn't the self-funding that failed. They didn't find a way. They were missing the next part, which is the medical strategy, right? So in other words, how are you going to pay less for your claims? If you don't pay less for your claims, or you're not able to shop. So I found that's a key part in where companies or brokers or whomever have given up on self-funding. And it always kind of gets me going. It's like self-funding didn't fail. You just didn't put in a medical strategy. You didn't have any other way to save money. And so the kind of the fun analogy I've been using, right, is most don't actively manage their health plans, especially on the fully insured side. But when you're on the self-funded side, you want to actively manage it. You ever play Yahtzee? You ever play that game? So that's kind of an old school game. There's even yard Yahtzee now where you got those gigantic dice. But we play it at home, and we even have an electronic version on a little game board. But my daughter and I play it, and it's kind of funny, right? So I think with most plans, would be lacking a medical strategy. You roll your dice in January, and then in December you look at them and you say, "What I get?" And that's about as active as they get, right? Where you and I both know, let's roll the dice the first week of January. Let's keep the good ones. Let's roll again the second week of January. Let's keep rolling those dice and sorting those dice. And some good things have to happen. Are we having MRIs, or what are we paying for MRIs? Are we having surgeries, etc.? And let's really get involved in this plan so that we would manage it like any other areas of the business instead of ignoring it like employers have done.
Yeah, and that gets us then to, if you put these strategies in, you cannot just expect everyone's going to embrace them and start doing them, right? Now the engagement side comes big. And once again, if you don't look at your dice in your analogy until December, you don't even know who was engaged. You have no idea what's going on. And you go, oh my gosh, this was a terrible idea. Fire our broker and bring somebody else in. Right. Because this didn't do anything. Our costs are more. We're fixing to get a bigger increase than what we had. Why? Because you did nothing, and you didn't expect anyone else to change either. So it was an overall failure, like you mentioned. But what effective strategies have you seen to bring engagement up?
Yeah, that's a great question. I get that question a lot, having led HR, and I was always kind of a different HR person in that I actually drove change. I found that in some cases, HR folks are transactional, or they avoid change. And if there's any HR folks listening, I would say, take some chances, get out there and help people, and you can take calculated risks. But this thing about no change, as Dave Chase had said, HR people are basically given two directives from their presidents or CEOs. And I would agree with this. It wasn't verbalized to me, but, keep them happy and keep us from getting sued. Like, well, that's kind of a lame role, really, right? And keep them happy. There's a nail in Jello to a tree target kind of thing. And I would say, is 20 years of really high premium increases and deductible increases, is that keeping them happy? I don't think that's keeping them happy anyway. But yeah, in terms of engagement, if you were to ask, as I say in the book, if you were to ask me pick one word to describe leadership, and we all have our own word and there's no right or wrong answer, but my word is involvement. And I believe no one's ever disagreed with their own idea. And I believe that when you can skillfully ask people their opinion, or maybe what I call the four most important words, what do you think? Doesn't mean we're always going to be able to go with your suggestion, but you had a voice. And I believe that people that are in the game are much more likely to play hard versus you ever ride the bench in sports? You ever play sports and ride the bench? I mean, maybe you're a good cheerleader from the bench, but I always found if I was on the bench, I was frustrated and, I wanted to be in the game. So those that are in the game now they have a stake in the win or lose. And so lots of collaboration, lots of involvement, empowering experts to do things. And There's all sorts of skills and gifts and talent out there far above what I've got. And so if you can just be the facilitator of that, a lot of good things will happen as well, instead of trying to do it all yourself.
No, I think that's very important. But I want to go back, as you mentioned, most of your career has been HR.
Mm-hmm.
So I'm guessing you attended now and then HR conferences here or there, whether they were state, whether they were national, whatever. You went to this conference where, in many cases, they're rolling out the newest, latest, greatest thing that you as an HR director has got to know about. How much of that and how much of that noise in the HR world is worth your attention? And what I mean is, we talked a little bit ago before we started this about all of the new fads, what all the HR people need to know, and what all your employees want to know or want added as benefits. And you're going to be left behind if you don't add these benefits, all of these things. How much attention should HR people pay to that? Or should they actually do what you just said and do something nuts, like ask their own employees?
Yeah, I think maybe it's skewed a little bit for the type of folks that go into HR, so maybe it's like personalities so it's a skewed sample, if you will, in terms of being risk takers. So I have found that HR folks aren't risk takers. But what I've also found is that over the years, I've worked for several companies and I've inherited teams that I've led. And a lot of times, I'll be humorous here. The first year they think I'm full of it, or I'm too optimistic. But usually by the second or third year, they start to catch on and they start to act like me, and they start to say, hey, we can make this better and we can make this better. And that'd be actually fun because we're here anyway. Might as well have fun, right? And they start to think a little more like that. And so it's not as much as they're permanently that way. It's just they've adopted a lot of practices. How do we hire someone? Well, here's how we hire someone. Then I'll say, how's it working? I don't know. I was in a room once with 60 HR people, and I had just met with this consultant beforehand, and I was showing him our healthcare graphs, and he was really impressed and inspired. But he said, he asked the room, he said, how many people have some sort of measures for whatever you do, turnover and healthcare costs? 2 people, and I was one of them. 2 people in the room raised their hands. So I don't think HR people are trained to do that. And so I think I started out with a Toyota supplier in Toyota, a big flagship plant in Kentucky with 8,000 people and 3,000 cars a day. And we had rooms, even just HR, huge rooms, plastered the walls with measures. And so I guess I kind of learned some of those good habits early on. But to me, that's always what has made HR fun is it's a little, a conversation with someone for an hour. You may not be able to measure that, but what can we measure and how can we then move those needles? That's what's always, and because you're doing that, you're helping people, right? If 5 people say the attendance policy sucks in one day, it probably sucks. And you probably should start talking to people about how to make it better. And of course, going through that change is frustrating because there'll be someone who doesn't like it. And, I think a lot of people avoid the change because of how challenging it can be. But I haven't. I've always kind of just dug in and tried to get as many to come with me and went forward. And most of the time, I would say the outcomes were good.
That's interesting because in conversations with folks like Dave Chase, Nelson Griswold, those guys' thought process on HR people is their adversity to risk is one of the reasons why they don't want to give level funded or self-funded a shot at certain sizes. I mean, you get to certain size companies, it's almost a no-brainer. They almost have to. But you get to those companies that are 50, 80, 100, even 250, there's pushback there because we've always been fully insured, and it's just that's just what we're going to get, an 8 to 15% every year. We just put it in the budget. We don't like it, but the old saying, no one ever got fired for having Blue Cross Blue Shield, right?
That's very true. Yeah, and I was actually thinking the same thing as you said. That is, most people are, if they're not risk takers, well, then why would I risk my livelihood? I've got a house payment and I've got children and so forth and a car payment. And I guess I might be wired a little different way, that I've always had, typically had success. So I may be a little more courageous, but there's a lot of truth in that. And then some companies, it's not even safe. It's the culture is just not safe. So one of the things, if you're going to lead a change, or if you're inspired to transform something, whether it be a health plan or something else, it's good to get the support from those above you. Maybe it's a board. It probably, in most cases, it's CEOs, or if it's a family company, the owners, and educate them and let them know of the potential, but also that the change process is not going to be perfect, because there are cases where someone has even tried to lead change, and then you get in that middle desert, as I call it, and a couple of things go wrong, and people start talking like, I guess he's just not performing, and he's not really, and pretty soon you find yourself without a job. And that has happened. There's a lady, it's not common. I think you fight through it, but I know of HR, I know of folks that's happened to, and it's never happened to me specifically from a change process. I've been reorged a couple times, but that is I think the greatest fear is like, I'll lose my job if this doesn't go well. And that's a real fear to have.
Yeah. And if someone is in that mindset, or maybe they're more like you and they want to change, but they're having a difficulty even broaching that subject with upper management, with the CFO or the CEO or the owner, or whoever that is, what steps do you recommend they take? I understand you said, hey, here's what the savings could look like, but how do they even find that out? Where are they going to maybe get some of that information? Where's a resource that may be able to provide them some of that to start the own change process in their mind to see what's out there?
So you're talking about education of how to do that?
Yeah, that. And so let's say someone, they're just always Blue Cross, and they hear about these other things out there. I know that just changing every 3 years from Blue Cross to United, then United to Aetna. Right. I know that's been our strategy. Our strategy's been to make this change, right? But what's another strategy? Well, I've heard about this self-funding or level funding thing, but whenever I brought it up to my brokerage, they're like, no, you don't want to do any of that stuff. That stuff's dangerous. That stuff's crazy. But I want to learn more myself, because these guys, maybe it's not in their best benefit, but maybe it's in ours. What's some resources that they can go to kind of get that? I mean, I know you have some resources in Wisconsin because you have a best practices group. So if someone's there, tell us a little bit about that group and how you started as well. But any other resources you think an HR professional could use to get some of that information?
Yeah, I would say, interestingly, like on the employer health plan improvement, I would say the resources maybe they're more. But I always found that the change management books I read weren't giving me the answers I was seeking. There's one called Leading Change. It's kind of an old book by a guy named John Cotter. He was a Harvard professor. That one helped me. I have a really cool leadership video from Lou Holtz. That's probably my gold mine. It's not even published. I'm glad to share it because it's 20 plus years old. But Lou Holtz was a transformational leader and a coach. He took 6 losing football programs and made them into winning programs, including the national championship. So the literature and the resources are slim. But I would say a lot of it we know inherently. And probably the mistake I made, the biggest mistake I made early, the first half of my career, if you will, when I was very passionate, but I was still young and green, is I would try to do it all in one meeting. I would see a clear opportunity. I would know how to fix it, but I would go have a conversation with the president, and I would try to have it all in one meeting. And that's actually a mistake. And so that he's got, or she's got 5 other things on, their mind. And so I would start to do the faucet drip. I'd be in a meeting sitting next to him, say at Merrill Steel, and I'd say, yeah, our healthcare, I'm seeing a trend of our healthcare. I started measuring our healthcare costs the last 5 years. I'm seeing a concerning trend. That's it. That's all I'm going to say right now. He's got to get to his next meeting. So do I. Then the next time I'm going to maybe talking to an owner. This is actually our 3rd biggest expense, and I've got this graph I've been doing, and so then I'm going to just say that, and then I'm going to move on. And I plant these seeds, and then when we're ready for the bigger meeting, I'll say, you know what, I really think we need to do something here, and I don't know what yet, and so get them to detach, get them to say, we agree, we need to do something here. And then you can start talking about solutions. When we started implementing even the on-site clinic at Merrill Steel, and I could show you my justification proposal, and you would probably laugh. And I laugh because it's misguided. It's good intent, but it has everything from saving 18,000 off of drug screens to, very minimal stuff. And then we found out where the real money is, right? In the secondary referrals and things like that. But after that, I didn't need to make a lot of proposals. I had the trust. We had saved big money just in the first quarter. And so a lot of that is just also not being afraid to jump in and learn. A lot of the wisdom, for years, I would always search for this wisdom, if you will. And I rarely found it in books. I just had to go out and try and learn it the hard way, if you will.
So you mentioned something that I think is very interesting, and that is you're in a group with 60 HR professionals, and and the question is asked, who keeps data on various things, anywhere from how your health plan performs to kind of what you mentioned earlier, how your hiring practices work. Maybe they have simple things like attrition, right? So we know what our turnover rate looks like because you almost have to, depending on the industry. But the fact that is not a really followed thing, something that is just, that kind of boggles my mind, that is not just, of course we follow that. We know exactly what our health costs are. We know what the trend is over the year. We know all of those things. The fact that they don't have that information is kind of crazy.
It is, doesn't it? It makes you want to kind of bang your head against the wall, especially if you've had that experience. And even that, I'll call it fun, is measuring something and trying to improve it. I think the cultures make people hesitant to change. That might be the invisible monster behind a lot of employers' hesitation to do things. I had one person tell me, Matt, you never admit a mistake. Now, these weren't healthy cultures. But I'm like, what? Never admit a mistake. Even if you make one, don't admit it. They'll eat your lunch. And I had one, there was an example I put in the book, as I had started measuring, I had a little packet. I called it an HR dashboard, and we'd go through it every month. And the goal, by the way, the goal is to know where you are. You can't determine where you're going to go if you don't know where you are, right? And so the first step is to say, here's where we are today, and then how are we going to make it better? So the goal, the motivation is good, but I had showed him a graph for his areas, right? And their turnover, it was kind of ugly, as probably many areas are, and many companies today, just by the nature of the workforce today. And there's more jobs than people. But so I showed him that graph, and he said, you can't show that, right? So it wasn't safe for him. I wasn't trying to embarrass him. But I said, how are we ever going to know if we even improve if we don't get a baseline measure? And so just wasn't the way that I'm wired. But his motives weren't bad, but his motives were, I'll get in trouble, I'll lose my job kind of thoughts. And so top leaders of companies need to make that safe for people to first measure where you are, even if it's bad, because your goal is to get better.
Yeah, and that kind of goes back to what you said earlier. I'm not wired to take a risk. My job is to manage, that HR thing is to manage the situation. Whatever I inherited, I'm not going to try to make it better. Maybe I'm making an efficiency change here or there that I see that's kind of blatant. But other than that, we're just going to roll on with the status quo as long as I don't screw anything up.
Maybe nobody will notice. Or this is just normal for us to suck at.
It's just normal.
Healthcare, right? Say healthcare or turnover.
Right. We hear that, right? Okay, this is the restaurant industry. We have high turnover. This is the service industry. We have high turnover. We can't do anything about our healthcare cost. Okay, we're a company of this size, and we get this kind of renewal every year. That's just the way it is. There's nothing we can do about it. I mean, we hear this churn all the time. It's very interesting. I have a recent employer who owns a restaurant, and we've been trying to get them a health plan for well over a year, almost 2 years now. And they've got this great interest until it's actually time to do something.
Right.
And we've run quotes and we've run quotes and we've run quotes. And then, oh, we're going to do everybody. Okay. No, we're just going to do the management team. Okay. No, we're just going to do this. And every single time it's like we're something else. Well, we finally got down to what the real problem is that when you go to talk to the folks, which I finally got the opportunity to sit down and talk to the people, most of them have coverage somewhere else, or they're not going to spend the money on a health plan. They're just not going to. There's not a lot of income there to begin with because of the way of the structure, because of that business. And the ones that want it and are pushing for it need it because of health concerns. So now you get down to where maybe you're going to have a 30% participation rate. Well, no one's going to write that in most cases. You're not going to be able to get anything. So we came up with some very unique options for them, but they were almost embarrassed. The ownership was almost embarrassed to talk about and let us talk with these people because I've owned some restaurants in the past, so I knew what to expect. It's almost like, well, but if he meets my people, he's going to think that I'm nuts. Well, no, I know you're nuts. You own restaurants. So that has nothing to do with it. I know how crazy it is to own a restaurant. But the folks were good people. They're really good people. And most of them are young and don't really know what they want in life yet, and don't understand how healthcare works and don't understand how health insurance works. And they may not even know what's out there. So we actually made some very creative things for them. And now pretty much their entire management staff at a pretty low cost all has access to healthcare. Because when you actually had a talk with them about what they really wanted, they wanted affordable access to healthcare. So we were able to get them memberships basically in a direct primary care to take care of the needs for them and their family. Nice. That's the first step. And sometimes it's just got to be those little steps, right? It's a little step. So even if you're with a bigger company in HR, the first thing you did was an on-site clinic, right? You didn't just say, we're going to make this huge change. We're going to throw everything out and we're going to bring in this whole thing. It doesn't have to start there. It can start with baby steps.
Yeah, I always say the hardest part of a new initiative is getting it started. And so often we get this analysis paralysis. And I wouldn't have known anything close to what I know today about steps 2, 3, 4, 5, 35. But yeah, I mean, often I think we get so overwhelmed that we never take that first step. So my suggestion in those situations would be just get it started. And then don't worry about step 2, get step 1 running fine. And then once you're off, it's much easier. But I think that often stalls the car from even starting in many of those cases because they get overwhelmed by steps that stuff's going to change as you go. And you're never going to be able to predict step 10 anyway.
Yeah. And you're 100%. I mean, that's the well-known thing, right? What's the hardest step? Step 1. It's getting started. I mean, we can talk about this all day long. We can make plans all day long, but until we actually implement something, we're never going anywhere.
Right. That's actually tied to motivational research. It's like, I don't want to do my math homework. I don't want to do my math homework. I cannot make myself do my math homework. But you sit down at your desk and you start doing your math. You're like, this isn't that bad. It's actually kind of fun, doesn't it? Right. But it's this getting started. Another kind of factor, I don't know if you've seen, and you have to be careful if you're initiating change. I happened to meet with a company earlier today, and I was inspired by a young HR professional. And she was someone had talked about maybe we should wait a year. And she said, no, we can't wait a year. We've got to go. And I'm like, wow, that's the kind of people that I want to work with.
Yeah. And for her, there's something right that she's measured that tells her we can't wait.
She knows we can't stay here. And so where I was kind of going with that is, one thing to be aware of, especially if you're newer, but sometimes with this change, let's say I don't know if she's newer. I didn't look how long she'd been there. I think she's within a couple of years, but say somebody new comes into an organization, company, and they see opportunity, maybe they start measuring something. You do have to be a little careful if you're newer, because maybe say someone's been managing that for 10 years or 15 years. And so they might be very hesitant or even scared or offended if It's like, because essentially what you're saying, if this is really broken, is that you failed. And that's really not what you're saying. But it
Right.
can, so there's all these people things that can stop, even when you know exactly what to do, they can certainly stall progress if you're not careful.
No, so that kind of goes back to your little whisper of this, little whisper of that. And maybe sometimes the person who's been in charge of that the whole time, it needs to be their idea to make some of these changes, right? I know that that's difficult, though. That is difficult for someone that wants the credit, I guess you could say. But sometimes the best thing to do is to not worry about who gets the credit, but to make the change, to help with that change, whatever it looks like, even if someone else gets to take credit for it.
Yeah, I think that's a Ronald Reagan quote. Have you ever heard that? It says, "It's amazing what you can achieve when you don't care who gets the credit."
That's
And so,
exactly right.
and a lead, a leader, a transformational leader, as I call it, so a leader who can go in and really transform something from A to B, or take a group from here to there. If it's about involvement, which is a great lever to pull to get that to work, then it can't be about you. It needs to be about a cause. It needs to be about an effort. And so the more people involved, the better.
Yeah. So big effort, big cause. Free Market Medical Association. Both of us are members of that organization. You have kind of taken the reins there in Wisconsin. Love, of course, Dr. Keith Smith and Jay Kempton have been on the show a few different times back whenever I was doing the radio show, and now they've been on the podcast they've been on. How influential and how much of an encouragement have they been through your process?
Yeah, they've really become good friends. As you know, Keith wrote the foreword to my book, and I've learned so much from him. I used to watch his video blogs or vlogs or whatever you call it, but his videos, and he's so knowledgeable. But I can tell you, they were an inspiration to me. They might say the same thing about me, because it seems they're so rare of companies that are, willing to really take chances. But I was coming back, we had 2 big locations. I was coming back from Missouri, and I'm a driver. I like, if it's like 10 hours or 11, I'll drive. I don't know if everyone's like that, but I like the predictability of it. So I got my car when I'm there, and I'm always there on time. So I'm driving back, of course, catching up on a lot of phone calls. You got 10 or 11 hours to do it. And so I called SCO. I just heard about them. I didn't know really anything about them. I looked at their website, right? And so now I'm into this next stage. We've got our clinic, and we want to start. We've got our on-site MRI, but now I have, if I can buy surgeries, high quality surgeries at low cost, I'm going to do that. And so I called the front desk of SCO, and the lady said, it was like a Friday, and she's like, "Yeah, just send Keith an email, and on Monday, and that'll get it started." In my mind, I'm like, really? Right? Why don't you? I had questions for you. Why didn't you just answer? Keith was never going to respond to me. He's not going to. So, right? I mean, who am I? So, I mean, Keith's like this famous doctor and so forth. And so I get in my office, and this was before really any of this became known. This was about midway, before I think even awards or anything. And so I type a little email with a few bullets. Here's what we've done, Keith. We've done, on-site clinic and MRI, and we pull up the truck and so forth. A few good things. But and this is early Monday morning, and about 10 minutes later, the little phone, my desk phone lights up, and it says Keith Smith, and I still remember that. And I'm like, yeah, it's not really Keith, but SEO's calling me. So you probably find this funny. I think I've told them the story. So I pick up the phone, and it's Keith Smith, and he's got his unique voice, and he's all excited. "Matt, he keeps saying, you're way ahead of the curve. You're way ahead of the curve. I'd love to work with you. You're doing great things." And that was the first time I got to talk to Keith. And then we scheduled. So I came down later, actually, with our on-site PT, and we both visited SCO, and Steve came in on his day off, and they spent 2 hours with us giving a tour and stuff. And so that was the start of that relationship, and joining FMMA. And the next year I shared our success story. It was still in progress. And so, yeah, pretty cool relationship. They've definitely supported me a lot in knowledge and encouragement.
Yeah, absolutely. I can't say enough about the support that they give us, all of us members, and it's been a great ride to see it grow too. The fact that this year's event, which I know you were at, we were both there, I got to visit some, was sold out. I mean, that's amazing to see the growth that's happened. And I mean, I know they were before either one of us got involved. They've been around, and we're coming up on this next year. It'll be back in Oklahoma City for the 10-year anniversary of the organization. And man, I'm really looking forward to it. We were very blessed to get to be a sponsor and get to be on a panel this year. I know that you'll probably have another opportunity to speak, because there's always stuff going on. And I want to get this out. I asked you about it earlier, and we kind of moved on from there. But the initiative that you kind of started with Merrill Steel has grown into a movement in the state of Wisconsin. And you're spearheading this best practices group that has just had its biggest event ever. And you're still moving forward with this thing. You've got some incredible speakers coming here, I think, next week. And so talk a little bit about kind of how that started, because it started super small and you didn't know what was going to happen. Then all of a sudden, boom, here it went.
Yeah, I think, some things happen to you, that you didn't expect. There's a lot of stories like that. And then some things you work really hard and you drive it. So I would say this is both. And so I was leading at Merrill Steel, and especially after the awards started rolling in and people started hearing about the money saved and employees were liking it and so forth, my phone started to ring a lot, and other local HR leaders or other CEOs, they were like, "How'd you do it? Tell me about it. Do you have time to meet?" And so I gave a ton of tours. Everybody wanted to see the clinic, and it was a beautiful clinic, and still is. And but the time became a little bit of a burden. So I said, why don't we start this healthcare? We labeled it in about 10 seconds. I'm like, what do we call it? Best practice. So we labeled it Healthcare Best Practice Group, and it was me and the lady at the time. She was the CEO of our clinic company, and so it was very no resources and so forth. So we invited a few people to the first meeting, a few companies, and it was still pretty low participation. I mean, there were less than 5 companies there, and then COVID hit, and we were just about to kind of grow it a little bit and stall their progress. And then after that, and then just in the last 2 to 3 years, I'd say even 2 years, we had a local employer is going to host it. They had this beautiful big room. And so central Wisconsin in this time was kind of following my lead. They were it's the least populated area of Wisconsin of the 5 regions, but it's the most active in healthcare. And the 3 most populated areas, what we call the Fox Valley, Green Bay, all the way to Oshkosh, and Milwaukee and Madison, have millions of people, and they're still mostly asleep with the healthcare movement. So we're trying to wake that up. But anyway, so we did our first event, and we had over 100 people show up, and we were expecting like 30. And so we said we might be onto something. We'd have these success stories, what I call the 6 mature stories in Wisconsin. The leaders of those stories speak. And John Chirinos, who wrote the first book on this topic, right, an employer success story from the employer. Mine's kind of like the second of that. At that time, hadn't even close to finishing the book. I'd really finished it up in the last year, but he showed up, and I was kind of like, whoa, I had never met him. John's here, like the grandfather of this movement, right? I'm like, hey, John, thanks for coming. He's like, I'm getting back in this. You've inspired me, Matt. Da da da. So we just kind of, he's been speaking for free. He doesn't usually speak for free. I think he sold 30,000 copies of his book, his first one. He's got another one out I haven't read called Grassroots of Healthcare. But we just started. So we started kind of alone, if you will, right? It's this change management process at a much bigger scope. And then we just kind of tried to then get networking. We tried to get everyone with us. How many will come with us? Everybody's got their own skills and backgrounds and experience. And how many we can, so creating this movement. And just recently I named a kind of form. I was always kind of against a newsletter, I'm like, nope, it's an update. I would joke with my co-founder, it's not a newsletter, it's an update from Matt, and he'd laugh at me. But we would kind of I didn't want it to be formal. And so we relabeled it. I called it the Wisconsin Movement with an arrow to the right. So it's still pretty informal. But now we're up to 1,400 people on the list.
Wow.
And 400 companies. And so we're starting to gain traction. We've got the Milwaukee event, as you spoke of. We've got Wendell Potter coming in and Chris Deacon, and we'll have probably over 100 people show up there, which was tough in that area because they didn't know a lot about this stuff, and maybe more. So we've just a lot of hard work, a lot of active activity on LinkedIn, as you see, and educating, and we've also been traveling around the state. So this would be like something like the fourth or fifth we've done this year. So really what I call setting grass fires throughout the state. Not trying to have a big bonfire in the middle, but setting a whole bunch of small grass fires and then letting Americans do what they do best, innovate and fix problems. So
yeah, one of the things, you were on our Why Does Healthcare Suck audio room the other day when we did that, and you brought that point up then as well, that you don't just go in and set a bonfire. You set these grass fires around in different places, and in particular in a state that has as many, I won't say problems, but as with as many barriers to healthcare and the cost of healthcare that you have in Wisconsin. Setting those grass fires and then showing the results and once again having these employer success stories in your best practices, that's what really gets the movement going.
Mm-hmm. Yeah, it's involvement, right? It's the same strategy I've used within companies, and it's just of a much bigger scope. So it's really national, if you will, a little bit. I mean, the concepts apply nationally, but we've kind of focused on Wisconsin first as kind of a territory, and it's amazing. There have been people here that have been working on this even before me. The John Trinas, or maybe some DPC docs that started 10 years ago, or a navigation service, Aletheus, that started 10 years ago. So there were a lot of folks trying, and but maybe some have told me that I've been able to bring it together. Someone had told me, in fact, he's a hospital exec. He said I was outside of the hospital and I had tried to get this going, but he said, you're actually doing it. And I would bounce back and say, well, I'm facilitating and I'm doing my part, but a whole lot of people are doing this movement, right? I've just been able to inspire and involve and educate, but my goal is to get as many people involved. My goal is not to be the one or the spotlight. My goal is to get, like I said, Americans involved in what they do best.
Well, and see, the difference that I see, of course, is your passion for it. I really believe, in my heart of hearts, I really believe that one of the reasons that you are a great person to lead this is because you truly are from the employer side. And until the employers, from the top down, because it's got to come from the top, understand the true battle that we're in, understand the true ramifications of not making this change, of not taking control, and realize that it's only from that place are we going to make a true impact on how healthcare is accessed, and make an impact on it not the cost of it not going up anymore. There's got to be a demand. There's got to be a demand that it doesn't continue with the status quo. And the biggest purchaser of healthcare are employers. And until they make that determination, until they get that mindset, and they just don't say, well, there's nothing we can do, another rate increase. And you know what? Those guys really are looking out for our best interest. Until that happens, then we're going to keep on down this pathway, and rates are going to keep going up, and healthcare is going to keep going up because, as you've heard, as I've heard, and I agree with, our healthcare system is not broken. It is not broken, folks. It is absolutely 100% working the way that those that designed it wanted it to work. It's enriching those it was designed to enrich, and it's making the ones broke it was designed to make them broke. That's what we're in right now.
Yeah, very much so. And it's like, I call it payer power, right? So when I first realized this at Merrill Steel, that the payer has the power, because I choose who I pay and when I pay, and So I think that's a recognition, but it's kind of like standing in a burning house. And so that's what I'm kind of seeing now. Employers, they know the house is on fire, but they're kind of like, as you mentioned, we got a slow cycle. So it's once a year you make a decision. So it's a slow cycle. It feels forever. But I just don't think it's hot enough yet. I just don't think it's hot enough yet. So I'm going to wait another year, see if the kitchen catches on fire. Now maybe the living room's on fire, right? But eventually when that pain is enough, even if they're not even measuring well or trends, but they're going to see eventually the CEO or the CFO is going to say, time out, this is unsustainable, because it is. Then they'll go into action. But we're trying to kind of speed up that process and saying, the house is on fire. So wouldn't it kind of make sense to start, doing something today instead of when the heat gets so hot you can't stand it? And so that's a never ending, right, leadership education role.
Yeah. Well, and we kind of started off with this, but what do you see the impact of what's happening with the CAA, with the Consolidated Appropriations Act, and all of these lawsuits? What do you see that do you see that speeding up this process? I guess is what will that kind of things bring employers around quicker, because they're actually seeing, in the case, I'm going to use this Heinz Kraft and Aetna. If Aetna is not even the slightest bit concerned about taking advantage of a huge corporation like that, do you think there's some companies out there going, my gosh, we're only 120 employees, what are they doing to us?
Yeah, I think I've been promoting that. In fact, I'm going to start promoting that a lot more. If you saw a post I did today, it said that the article said this is the tip of the iceberg.
Yep.
And I have another one ready. I'm going to share probably Monday. And so if anyone hearing this ever comes across any new lawsuits or articles about this, please send them to me, matt@selffundhealth.com. But I believe this is a big deal. There's an interesting dynamic here in that employees or unions can sue, employees can sue their employers. That's not really what I'm after. I mean, someone said that today, you're not intending that, are you? And I'm like, no, that's not really what I'm intending. But if that motivates them, and wouldn't be such a terrible thing. But what we are seeing is a trend of employers even requesting data, not getting it in jumbled coded forms, or not getting it and finding, and really, what are they hiding? So the things that we know that are the things that Kraft Heinz has found out, or Ford has found out, or others have found out, I think is happening across the board. And right. I think probably a lot of closed door meetings going on in brokerage firms and carrier firms saying, oh crap. And they probably have lawyers in the room and saying, what's happening here? So I'm going to keep shining that light, and I'm going to keep, promoting that, because I think it's a great motivator. I was looking at a plan today, and someone pointed out to me, so they had something like $2.8 million in cost, and then there was another 1.3, and it said NA by it. This was their breakdown, NA, N/A. And I thought, boy, if that's not a lawsuit waiting to happen, because what NA, and we were joking, well, couldn't they call it miscellaneous? But that NA is something we need to know what that 1 point, and we're not talking about $50,000,
right?
1.3 million. I'm not that large of a company and not that large of a plan. So these are the kinds of things that we are happening all over the place. And so you're darn right, I'm gonna leverage that and promote that. And I think it will motivate people into action is my real goal.
Yeah. And, I want to point out something, because you kind of touched on it right there. This lawsuit from Heinz Kraft against Aetna is not at this point saying they charged us too much. It's saying we want our data.
Right.
Now, we've already seen that you charged us some crazy prices in there, but that's not what the lawsuit's about. The lawsuit's about is we asked you for data. You took over a year to give us data. And then what you gave us is all redacted. And, what we do have, we've already found some crazy number, millions of dollars that you can't really describe, almost like you said, NA next to it. What is it? But we want it in a readable format, which, if I recall the comment in there from Chris Deacon, was they're not asking for anything out of the ordinary. They're asking for a standard way that this is presented in a readable format. And I've seen that kind of format. You've seen that kind of format. It's not that unusual to get that from self-funded and level funded plans, but apparently in some cases it is.
It's one of the biggest triggers for success for a plan is having some visibility and getting decent data of claims data. And you buy something, but you don't know what you've paid or how much you bought. I mean, it's just somewhat unbelievable when you start thinking about it. And so, yeah, I mean, it raises question: what are they hiding? So they're certainly able and capable of producing timely reports, and they're not producing them timely, and they're not producing them accurately or so they're readable. So it's a trust breaker. If you look at Chapter 5, choose trustworthy partners, right? It's a big deal, and you've got to be able to trust who you're working with, because if you can't trust them, then what do you have, right? You have nothing.
Well, and so let's kind of go back and let's look at this situation in one more way. You mentioned earlier, and you used the Yahtzee analogy. What Heinz Kraft really did was they rolled the dice and they never even checked the dice all year. They just didn't. There was no follow-up, like you mentioned earlier. There was no, let's look at a week, let's look at a month, let's follow this trend and let's do anything. There was no management of their plan. If there was, it was all done by Aetna as the administrator. The HR department, nobody at Kraft Heinz. I'm speculating here because there was, they should have caught this a long time ago if there was anything for them keeping track of. They just let it go, and they trusted. Here's your trusted partner. They trusted that Aetna was acting in their best interest.
One of the, if you had a chance, Eric Bricker,
Bricker.
Yeah, he does some great videos. And one of the things he points out is that one of the sparks to this situation is you had a new director of Total Rewards. She was only a year or two in. So it made it safe. In other words, it's not like, oh, I've missed this the last 20 years. She went in, I think, and was a spark there and said, we'd like to start managing our claims and managing our plan, and we can't see it. And so there's and it turns into that. So good for them. And I hope more companies would realize the importance of that. I certainly point out in the book, and you've probably said, and a lot of people realize, but we're talking about not just an HR retention gain or something here. We're talking about a company's second or third largest expense.
Right.
And it's not being managed at all. You've heard my vacuum story where I had to get approval for a $500 vacuum, but I signed a $700,000 stop loss that morning because it was off the radar. And so it's time we put healthcare on the radar. It's a huge business expense, and we should be wise in our shopping like we would anywhere else. Companies manage office supplies down to the dollar or penny. And here we are writing 6-figure, 7-figure checks, and we're just trusting. And in many cases, those partners have taken advantage of that trust and they've lost their way.
Yeah. And I thought Dr. Bricker's video pointed out some other interesting things. So I recommend you go out there and look for that, guys. It talked about the fact that the top management of that company is not United States based, and that could have actually something to do with the reason that they were bold enough to go ahead and file this lawsuit. Anyway, we won't get too far down that rabbit hole here, but I thought it was very interesting, some of the reasonings that he felt that this could have happened, including what you said, new HR leadership, but leadership overall that was not a fan of the United States health system, and so was a little bit more than willing to kind of go after this. But that was a kind of an interesting thing. Well, we talked at the very beginning that I want to kind of get off subject a little bit, that you're a big proponent and a longtime foster parent, and a big believer in that system, big supporter of that system. So I want to give you a little bit of a platform here to talk about that, kind of how y'all got involved in that, and how encourage some other folks to be involved as well.
Yeah, it's something. So, I think it ties to my wife and I. We have a love for our community. We believe, we all should do our part in some way. And so we felt called to be foster parents. And then we were asked to be, there's maybe two two or three sets, but one of the champion parents for our county, the biggest county in Wisconsin. And so we go to churches and talk, or we do support groups, or when there's groups exploring foster parenting, we go and give them the real answers, if you will, from foster parents. And then we are active foster parents ourselves. We probably had 25 or so kids or more come through our home, sometimes for a week, sometimes for a year. We've taken 4 or 5 or 6 babies home from the hospital, carried them out like they were our own. They weren't our own. We've adopted one. We've got one in maybe that's headed that way. So we've, certainly just have a heart there. We've started a nonprofit where we take in goods and we store the goods and we give away the goods for free, called Noah, the first child we adopted. So we've been pretty active in that. And I think it really ties to our love for community, and of course, children as well. Children who can't help themselves. And so that's why I've decided, by the way, $2 from every book, wherever it's sold, will go into a foster child fund, which I'm over $550 already. I thought, $2, that's not going to, so I'll decide how I can best benefit those kids, and I'll publicize it when I do. But first I said it, if you get it from me, because Amazon takes most of what's left. And I said, no, every book I sell, $2, we'll just keep it simple. And so that's a kind of a side benefit to buying the book, is that you're helping the foster children as well.
That's awesome. That's awesome. And I know whenever you had reached out to me about purchasing some books, and which I happily did, then you gave me that particular part of it, and that made me even encouraged even more to be able to donate to that cause as well. Now, if someone wants to get your book, you mentioned it's available on Amazon, but they can also get it directly from you, correct?
Yes. Yeah, I'd purchased 1,000, I've got in my shed. So Amazon's probably the quick and easy way, but if you'd like me to sign it or make a note, I'm glad to do that. And I can mail that off to you. Yeah. And
all right. And that
I've got the Kindle as well is available. And then I'm going to be starting the audio soon.
Okay.
I think I've had requests for that because people like to listen in their cars. And so I've got software. I've had a friend help me load the software. It sounds like a challenge to me. Now, you do more podcasts and stuff, but to read 228 pages and like not stutter or miss a word, that sounds challenging to me, but I'm going to give it a shot.
Well, I'll tell you, it is, but kind of like anything else, bite it off in little chunks. Don't try to read 228 pages, right? Read a few pages at a time. Get you something to drink, chill out for a little bit, and just kind of pick it up a little bit. Bite it off in little chunks when you got 5 minutes here, 5 minutes there, and it won't seem like it's that big of a thing. And I think you'll get through it faster than you think you will too.
Yeah, I think once I find my groove, maybe, it's how to eat an elephant one bite at a time. So maybe it's a section or a chapter a week or something like that. So that is in the works.
That's very cool. Yeah, there is a lot of people that like to digest stuff that way and do much better. My daughter, who is a biochemistry major, I don't know where she got that from. She certainly didn't get it from me or mom, but she does much better listening to these things. She puts her earbuds in and listens to videos and listens to it read to her. Now, part of it may be because of her dyslexia, but having that, it just makes a big difference to her. Whereas I'm a reader, I want to actually read it, and I digest it better after I read it. My wife laughs at me because I kind of go through these things with these stories, Matt, like you're talking about, all the different lawsuits or the whatever stories. And I've got all these tabs up at the top of my thing. And as I have breaks and I'll go through them one at a time, then I'll read what I can of the story. Sometimes I get through with it. Sometimes I don't, but then I'll keep that right there and I'll move it maybe back to first. So I know that I didn't finish it and don't click it away.
I gave a book to, I think it was a CFO today, and then someone had joked he'll have it read in 2 days, and so some people are really good readers. And then, I talked to a senator. If you've ever seen my testimony that I gave in front of a Wisconsin Senate, it's kind of cool because they were inspired at the end. But one of the senators said, I've been listening to Marty's book on my commutes, so I think people are busy, and you get a 4-hour trip. Well, it's pretty easy, but maybe it's a 30-minute commute. And so you can knock out a little bit. So I think it's definitely going to be something that people continue to ask for. So
yeah, absolutely. Yeah. And so I just want to remind everybody, the name of the book is Save Your Company, Don't Feed the Beast. It's the employer healthcare success formula. And that's exactly what it is. So I highly recommend it as a read. If you are an insurance advisor, insurance broker, you need to understand the process. If you're an employer, I highly, highly recommend that you go through this, whether you're already taking action or not. You need to see the process. You need to see some of those successes. Maybe you're not getting the results that you expected. Maybe you are, but reading the book may give you still some inspiration on other things to do to even be more successful. My folks at Eagle Care get so tired of me saying this, but it is my mantra. It can always be better. It can always be better. It can always be better. There's ideas out there to make things better that have not even been thought of yet. And maybe this book inspires you to think of them. Maybe this book, you read it and you make a comment, or you send something to Matt that it inspires him to come up with that idea. It's like it's hard for me to say this as a lover of classic rock and classic country and such, but all the best songs have not been written yet. All the best music has not been released. That's hard for me to believe as a lover of 70s music, but there's still good stuff out there. There's still good stuff that comes out there, and there's still innovations in this industry. There's a lot of innovation that can still happen. There's a lot of great things that we can still accomplish together. Just like the story said that the tip of the iceberg from what the CEA has started is there. The tip of the iceberg and the changing of the way that we can have an impact on the United States healthcare system, we are just at the tip of the iceberg. And it is paramount for us to keep fighting the good fight and to allow folks like Matt to continue to fight that fight, promote him and lift him up in any way we can to help him in his pathway, and for us to be part of the solution instead of part of the problem. It is so easy to maintain that status quo. And if you're a broker out there, if you're an advisor out there that is just living off that status quo, just know you're part of the problem. You really are. And it's time to make a change, because if you don't, that change is going to make you. And you're going to be found out just like these insurance companies are, because the CAA is going to shine a light on you as well. So I'm going to call you out, boys and girls, because it's the only way change is really going to be made. It really is. Matt, you got any closing comments you want to make today, buddy?
Sure. Yeah. You've probably seen at the end of my notes, but I have a saying, the cavalry is coming, but the cavalry is spelled CAA at the beginning. So
yep.
Yeah, I think there's so much energy here, and we've awakened a sleeping giant. And the big one of the biggest things, we get as many people in the game, and now is the time to change, because the light's about to be shined. So no point in riding in an unsustainable wave. And so if you see Chris Deacon, ask her about the book she's writing, because she actually has joked with me about it. She actually has an idea and has a desire. So I think it'd be funny if a whole bunch of people asked her about it. I've also asked Keith Smith, and he hasn't agreed in any way to write a book, but I think he should write a book. So maybe we can encouraging just a lot of people, yourself, a lot of people with these life experiences and this knowledge, to write more books and to build this momentum as much as we can, because that's what's going to make the difference. We're up against some pretty wealthy entities, pretty powerful entities that like it just the way it is, as you pointed out. And so this is going to take a lot of effort and work to open up this free market, which is really the secret.
It really is. And the one thing I want to point out here is that I've been an insurance broker for a long time. And for a long time during that time, I thought Blue Cross, Aetna, Humana, all those guys were the good guys. I did. There is something that happens in everyone's career. It is something that happened with Matt. You read his book and you get to see that. There's something that happens with everyone that's in this industry that changes their mindset. But in my case, it was because of what I saw happening to clients that I knew was not right. Mm-hmm. It's the fact that I saw people that were struggling, that had done everything right, had followed procedures, had done had followed the status quo just like they were supposed to, and we're still going bankrupt, and we're still denied access, and we're denied things that they deserve. They were not able to get the health care they deserve. And whatever it is, even if it's something as simple as knowing there's alternatives out there, don't be afraid to make that change. I know that financially, sometimes that can be one of the biggest things that holds you back, but how do you sleep at night? You know, I know you kind of wrote that too. What does your big conscience tell you? Well, some people ain't got one. We know that. Typically they work for big insurance carriers, but did I say that out loud? My point is don't let your love of money keep you from helping people.
Yeah, it's kind of hard when you develop a lifestyle and a livelihood. So I get that.
I do too.
I give an example of the conscience, right? That conscience is like a grass, and you step on it once and it bounces back up. It tells you something's wrong again and again and again. But you step on that grass enough times, in other words, violate your conscience or do something you know is wrong, that grass dies. And no longer do you feel that pressure or that guilt to say I shouldn't be doing this. And so that goes away, but it's still there. It's still deep down is there.
You know,
and I would ask that the brokers, consultants, advisors, all kind of the same thing, but right. Think about the sustainability, think about those employees and their families, and think about the golden rule. And the golden rule is that we treat others like we want to be treated. And that's certainly not just because we're in a position of power and influence doesn't mean we should treat someone else in a way that we wouldn't want to be treated. So there's a whole bunch of aspects. There's an ethical aspect. There's a future of America aspect here. And certainly would encourage anyone that's feeling the weight of that conscience to align your comp in a different way. It doesn't even mean you have to make less, but that employer, that's one of the things that upset me the most is that as an employer, there was so much comp that the broker in this case, or the insurance carriers were paying that I wasn't aware of. And that was our money. That was coming from us. All the money comes from employers and employees.
That's right.
On the commercial side. And so I had done a CAA request before CAA was even a thing. And I found that the broker was making about 2/3 of the income on the other side. And I wondered why they weren't working for me and why I couldn't get them to come along. Helped another employer recently with around 500 employees and found that the broker was making it disclosed around $450,000 a year. And the feedback that I got from the employer was they don't return our phone calls and they don't come to our employee enrollment meetings. And so they thought they were too small. I said, 500 employees is not too small to get great support. And so just examples like that, until we shine the light on these things and educate employers and employers get that fire under their seat and start moving, then we can really keep moving forward. So that's what we're trying to do in Wisconsin.
Yeah. And that's what a lot of the folks that like myself are doing around the country. The tough part of this for employers, and I'm gonna say this, and it's gonna be hard to believe unless you're one of us, and that is that there's about less than 500 brokers, advisors, consultants, whatever you want to call us, around the country that have this mindset, that are doing this strategy, that are really sitting on the same side of the table as the employer, because we're fully disclosing in every single way we're getting paid, and we're only getting paid by the employer. We're not getting paid by a TPA or by a carrier or by anyone else. We only get paid if the plan performs, and we get paid by the actual employer. And it's a very different mindset. And all it does is put us on the same side of the table. We truly work for you. And it's hard to find that out sometimes, but I will tell you, that's a question you got to ask when you're interviewing brokers. Ask the question, how do you get paid? the traditional way we get paid, and the traditional answer we'll give you is, oh, nothing you have to worry about. I get paid by the carrier.
Right.
Nothing you need to worry about. You ain't got to pay me anything. Well, that's great. I don't have to pay my broker at all. It's not great.
You are paying them, aren't you? You're still writing those checks. They're just, that money's flying around. Yeah. And that's probably the number one, right? I mean, to make sure there's no conflict of interest. I worked for family companies, bigger family companies, the latter half of my career, and they were a little more lax. I mean, it was more trust and kind of logic and so forth. But I'll tell you, the big Fortune 100, the big Fortune 500, I couldn't accept hardly as much as I could accept an ink pen, but I couldn't accept a baseball cap, or I could go to lunch once in a while. But, I had to be very careful. I couldn't accept gifts over really any gifts in many cases, because they were worried about me making a purchase, conflict of interest, that I get baseball tickets from this one, so I'm going to purchase this at twice the cost. Right? They were worried about those conflicts of interest. Yet in healthcare, somehow that's become normal, and we need a new normal here, because that one ain't working so well.
No, and it's funny. I'm not going to mention any names here, but we thought we had an opportunity for a school district here in the state of Texas, and we were at a meeting that some of the decisions were going to be made the next week. Well, we also found out that 2 weeks from then, the current broker was the sponsor of their district golf tournament, along with some other things. We're like, this is not happening. This decision's already been made.
Yeah. We run into all sorts of things like that. We find certain CEOs on boards of impactful organizations, and then there's all sorts of finances, and I get it, but there's all sorts of finances coming in from those. And so they wouldn't be able to take, say, an independent path because they're tied for the money here.
They're so tied to it. That's right. It's a situation. The other indicator to us is whenever the lead broker, I guess you can say, for the other organization come walking into the meeting, he had the umbrella from the local school district as well. He had their branded umbrella and was wearing kind of their colors and all. We're just cracking up. We're like, okay, whatever, man.
Yeah, anything you can do to secure the business, I guess. But yeah, I've even thought about drafting some kind of standards of ethics or business conduct or something for healthcare in general, employer healthcare. And that's a bit of an undertaking. I've got another project in front of that with foster care. We're looking to change the Wisconsin law. That's got to take precedence. But I think if we had some standards to follow and maybe started an organization, that might be something that could help, because there are just so many conflicts in politics right now with the healthcare as well.
Yeah, I agree. And, one of the things that I also believe could help, and I've already sent this out to a few different companies that, I just said, if you want this, I'll send it to you, is questions to ask. They don't even know what to ask. Right. And so there's certain questions you can ask that will start to kind of peel that back, start to peel that onion of where money's coming from. And if you ask these questions, the first thing I was like, well, how do they even know to ask that? Oh my gosh. Some of them, they're going to say, I don't know the answer. You probably need to talk to my boss. You're fixing to scare the heck out of whoever this is, because they're not going to want to answer that question.
Right. Yeah. And sometimes you don't always get a straight answer. Even if you ask the right question, you need to ask again in a different way. And right. I've got a couple of forms, I've got a draft letter, and also like a chart based deal to request compensation if anybody wants it, or if you want a copy. I'm sure there are many versions out there. But that, help form can help, where you say, here's exactly the information I need. And so to make sure they can't leave anything out.
Right. No, and that's imperative. And I don't want employers to think that it's as difficult as what we're making it sound like, and because this isn't, as I like to joke around, this isn't rocket surgery. It isn't brain science. This is something you've got to go through. But I promise you, once you go down, it may be some extra steps at the front end, but once you get that relationship with someone who's on your side of the table and you start down this pathway, even if it's taking baby steps, you're going to be in pretty good shape for a while. You're going to see the results over time. But the other thing, the worst thing you can do too, is think that you're going to see these millions of dollars in savings in the first year, because it is a process.
Right.
Typically, depending on the size of your company, it may take 3 to 5 years before you start seeing some of the full effects of making some of these changes, because it is also a cultural change. There's going to be an adoption, and in many cases, a gradual adoption of your employees. And until you get everyone on the same page and the culture changes in your company, there's going to be some hiccups. And you just got to know that that's going to happen. Or as we say, some noise. There's going to be some noise there. You've just got to be willing, as Matt has said multiple times, the change management. The management has got to change first. And if you're not 100% behind it, don't do it. Plain and simple. If you are not ready and you're not going to support it, don't do it, because you're going to cause yourself nothing but grief.
Yeah, very, very important. Very important, because right, people, we all like things the way they are, even if they're broken sometimes. It's still predictable and knowable. And but in this case, really, I think one of the biggest things to get people's attention is that we can't stay here. And I think once you can get them to agree to that, then you're in a much better spot.
Yeah, absolutely. Well, Matt, I really appreciate you being on today. I think that you're doing a great job out there in Wisconsin, and I really appreciate you sharing your story with the rest of the country, whether that be at FMMA or any of the other events that you attend. And I thank you so much for being on the podcast. I hope that somewhere out there, an employer got to hear this and it will inspire them to start making that change. I hope that somewhere out there, a broker or advisor heard this and it will inspire them to start making that change, to join with us in this movement that is really the only hope to change access to healthcare and the cost of healthcare in this country.
Well, thank you for having me, and thank you, Harlon, for all you do, because sometimes when you're in that spotlight or trying to lead this change, it doesn't seem like you're making an impact. And I'll tell you, and then later you find that someone you are. And I think the same would go for you. Thank you for what you're doing. And there are people watching and listening. And although it may take some time, you're certainly making a difference.
Well, thank you very much, Matt. I appreciate that very, very much. That means a whole lot coming from you, buddy.
You bet.
And don't forget, folks, we really appreciate you being here. But man, we have the weekly kickstarts on Monday, 10:30 a.m. Central Time. Keep you up to date on what's going on in the industry. And then also wrap that up on every Friday, the wrap, 10:30 Central Time. We're also doing our next big Why Does Healthcare Suck on the 29th of August, 11 a.m. Central Time. Be sure and join us there. You can also subscribe to the podcast at hwpowerhour.com. Thanks a lot for joining us again. Y'all have a blessed week.